Hey guys, thanks for watching my video. My name's Katie and I am doing my phase 1 reflection video for D159, and I'll talk a little bit more about what my project is and what I would be including in my project reports when I'm sending them out to my project team. So to start things out, my project plan is to help improve pain reassessment documentation in a peri-anesthesia care unit setting. So one of the things that we're currently working on my unit is to pain reassess when we're giving pain medications. So that's something that is continuously monitored throughout the year, and we have a benchmark for our unit for quality improvement and through our surgical services practice committee. And so that benchmark is constantly just slightly being missed, and so I chose that as an opportunity to create this quality improvement project and to help with that and improve those scores and help them get higher. So this is going to be for patients in particular receiving pain medications in our area, and those patients in receiving those pain medications would need a pain reassessment within 60 minutes of getting that medication. Some things present as barriers to that, so some of our recoveries aren't 60 minutes long, and sometimes patients don't receive pain medications, so patient situations could escalate and a pain reassessment couldn't be completed due to complications. So those are just different outliers that could affect our data. So the essential data that I chose for this data analysis for my project was including only the patients receiving pain medications that did stay within that at least 60 minutes of receiving a pain medication, and staff education completion rates, and also nursing pain reassessment documentation compliance. So those are the different things that I have included for my data analysis. For my project, my intervention is to include some staff re-education on pain reassessments and also provide a visual aid. And so the staff education completion rates would be based off of the electronic learning modules that would be assigned to them. As far as protecting the data plan, all the data that I would be collecting would be from the electronic health record database, and that would be pulled manually. So we would just be going into a chart. Each patient would be given their own unique identifying number so that everything remained anonymous, and it would be entered into a secure Excel spreadsheet, and that Excel spreadsheet would be shared with the members of our team. So the team members that I've included are the nurse manager, the surgical services practice committee chair, that is one of the people that pulls the data, and then our 2 charge nurses and a nursing education specialist that would be providing the education content for re-education. So the results of the project, I figured that I would use just a plain data table and a graph to include a more formal report, but just from manually pulling that data to be able to present it to my team. And then targeted metrics that I've included was having that 100% staff education module completed within 90 days of being assigned by the NES, weekly audits completed by myself as the team project manager, to see the overall project improvement, and as it's going along, how much is it affecting the nurses, are people catching on, and are we seeing improvement? And then to increase the nurse reassessment documentation rates 60 minutes after giving those pain medications. So for my KPIs, I included to develop 100% of the education plan by 5/18 of 26, and that has been completed. And then for the second KPI, I included to develop 100% of the visual aid process with the nursing education specialist also by that date. So that is just kind of all the data information based off the project report that I worked on during this part of this course. And I look forward to being able to providing those weekly reports to my team and including all of that important data and being able to receive any feedback on how things are going and noticing trending in the data and making sure that the project team makes those necessary changes if we notice that maybe things aren't improving or things are really doing well. Then that's something that we can highlight and inform the staff of either way on the progress of the overall project. Thank you so much.